Hey there, guys. Welcome to today's live stream, the last live stream of the year, which is hard to believe that the year is over. Hope you guys had a great Christmas. So, as far as any announcements today, the only thing I really want to sort of mention is the Christmas sale with my online fitness program. Um, it's still 50% off for the whole duration of your program, and the sale will end at the end of this week, started towards of course, the beginning of the year. I may have another promotion coming up, but as for now, I still am offering 50% off for the rest of the week until then. I don't have anything as far as promotion coming up just yet, but if I do have another one for the new year, I will let you guys know. But for the rest of this week, you can still get 50% off all my online fitness programs. Again, that includes Trainerize, that includes Evolution Nutrition. All of that's included. You'll be able to communicate with me 24/7. I'll be here to assist you and guide you through your workout program. So, with all that being said, I believe that's all the announcements I really wanted to mention. Um, and I will still be doing a live stream next week after the new year starts. So, I do have that event already posted. So, be sure to watch out for that. I may make a few changes as far as how these live streams happen in the new year. I'm planning on trying to put live streams on TikTok and Instagram. That's another realm that I'm going into next. And I'm trying to sort of figure that out. So, with all that being said, guys, let's go ahead and get into today's topic. So, what I'm going to talk about today is understanding heart rate and blood pressure. I'm going to try to go into a little bit of a deeper dive on this. You may know some of this, and some of this you may not know, but I want to go into more detail as to what heart rate is and the importance of knowing what heart rate and blood pressure are, as well as understanding them more in detail and how you can measure your heart rate and blood pressure, measure them, the metrics as they are. So let's go ahead and get started. So, what is heart rate? So, heart rate is basically the measurement of the number of times a heart beats within a specified time period. So, when you're measuring heart rate, it can be a valid indicator of work intensity and or stress. Of course, when your heart rate goes up, it's likely it could be exercise. It can be, different activities that, require more energy throughout the day. And stress, anxiety, anything of that sort can also raise your heart rate. So that's something to keep in mind. You know, of course, we know our heart rate changes throughout the day. Um, so one thing I want to mention is resting heart rate, which is known as RHR. It can help identify cardiovascular adaptations or regressions. Heart rate and resting heart rate themselves can vary between both men and women. So, as far as when we go into resting heart rate, this can actually be measured. It's actually, as far as my in person training, I do actually measure heart rate, and it's easy to measure your heart rate. All you do is you're usually going to just measure your radial pulse here. Um, and let me go ahead and go into that a little bit more. So, as far as measuring heart rate, the main one is going to be the radial pulse. But there's actually 9 different locations on the body that can be measured for your heart rate. And that's the temporal area, the carotid area, the apical area, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis medius. So those are all sort of the different parts of the body that you can measure heart rate. And RHR by manual palpitation, this is the most accurate form of measurement, is to measure the radial pulse. So heart rate is measured, of course, at many points in the body where an artery pulsation is transmitted to the body. and is often occurring when a blood vessel is compressed against an underlying structure such as a bone or joint. So that's how you can measure it, because that blood is pumping through there in that specific vein. And those specific parts of the body are easy to measure because of where the bone and joints are. So that's something to keep in mind. So what I'm going to go into next is I'm going to show you this graphic here of sort of how you can measure your own heart rate, your resting heart rate. So of course you can measure other people, and as far as, again, as me as a trainer, if I do train somebody in person, this is one thing that I do. So what you would do is you would sit comfortably for several minutes before testing. So when you're getting your resting heart rate, you want to be in a resting state, a calm state, where you would normally not be moving too much, not be doing so many different activities. You would want to be sitting down, just casually sitting. And when you're measuring RHR, again, it's with a fingertip palpitation. You use your index finger and your middle fingertips rather than the thumb, which has its own pulse. So that's why you don't measure with your thumb, because of the pulse in the thumb. So the fingertips are placed directly over the artery, and with lightly applied pressure, once a pulse is identified, you count the pulse for 60 seconds. You're counting how many pulses that you feel on your finger for that 60 seconds. And so note that there is no universal consensus on whether the first beat measured should commence with 0 rather than the number 1. So again, with this, it's approximate. You can't get the exact number of the heartbeat, or the pulse itself. So because the cardiac cycle being counted, whichever you decide to do it consistently. So when you're measuring it, you just want to measure it consistently. What I like to do is measure it multiple times as far as the radial pulse, because whenever you start, usually, I would wait until, like, you watch a clock and wait until sort of the second hand goes around, and then when it gets back to 12, I would start measuring it then, if I already have a pulse, sort of being able to detect a pulse. So when you're measuring exercise heart rate, this count can be measured over a 10-second interval and then multiplied by 6. So saying, like, if you measure a heart rate afterwards, say like measuring somebody's radial pulse after you're measuring your radial pulse after an exercise, you would measure that in 10-second interval, and then you would just multiply it by 6 seconds instead of doing it measuring the pulse through 60 seconds like a resting heart rate pulse. So that's a good indicator of your resting heart rate, and to see a quick visual of your radial pulse. Alrighty, so what is blood pressure? So let's go ahead and get into blood pressure. And I do want to mention the reason why I'm sort of discussing these today, both heart rate and blood pressure, is it's one of the most important parts of, especially if I'm training somebody in person. Now, I do recommend clients to do these themselves to keep track of their metrics, but as far as in person, these are things that I do make sure that I sort of keep track of: heart rate, blood pressure, because they're the most important baseline metrics to know. And it's not only that, but it sort of can be a good predictor of, if somebody has, maybe a certain disease, or their, high blood pressure and things like that. You'd be able to detect those things beforehand, and it helps me to identify if that individual is able to perform exercise based on these metrics. So that's a really good sort of indicator of your baseline health when you're measuring heart rate and blood pressure. Alright, so let's go ahead and discuss blood pressure. So blood pressure is defined as the outward pressure exerted by the blood on the vessel walls, reported as systolic and diastolic. So there's two different numbers as it relates to measuring blood pressure. And you have the systolic number, which is systolic blood pressure referred to as the top number, and it reflects the greatest number during the cardiac cycle. You have the diastolic, which is referred to as the bottom number, and it reflects the lowest pressure during the cardiac cycle. So that's what systolic and diastolic means. One way that I memorize systolic and diastolic is systolic I always see as the top number because normally it would be the bottom number. It starts with an S, so normally it would be on top, but it's actually on the bottom. And diastolic is at the bottom. So, you know, top would refer to like S is later in the alphabet, D is earlier in the alphabet. So that's kind of how I sort of know what systolic and diastolic means. And the reason I sort of have kind of memorized that is because when I was in high school, I actually took health classes. So some of this stuff I kind of have prior knowledge to, but there's stuff that I still have learned, becoming certified as a personal trainer. Alrighty, so let's go ahead and discuss measuring blood pressure. So you can actually measure your blood pressure at home. So there's equipment that you can buy that you can purchase at your local pharmacy or grocery store. And accuracy with these vary. A lot of them are just these electronic blood pressure sort of cuffs that you can buy. And it kind of varies with the accuracy of these sort of, blood pressure equipment that you can buy at the store. And as far as, I would take these sort of measurements kind of with a grain of salt because some can be accurate, some cannot be very accurate. So, again, with blood pressure measurements, it's best to go by your doctor because that's going to be the most accurate measurement of your blood pressure. So, with a physician, when they're measuring blood pressure, it's traditionally measured with a sphygmomanometer, and it consists of an inflatable cuff, pressure dial, and a bulb, as well as a valve. So this is something else to keep in mind too, or to sort of let you know that when I was in high school, I did take, like I mentioned, I took health classes, and I actually learned how to do blood pressure. So I actually was able to use a sphygmomanometer as well as the cuff and sort of learn how to detect blood pressure. So, again, what I recommend is that you go by the doctor's blood pressure measurement. And at home measurements, again, you can buy them. They're a good approximate indicator of your blood pressure, but sometimes they're not as accurate. Okay, so classifying blood pressure. So this is basically a chart that I've sort of created to sort of explain a little bit about the different systolic and diastolic measurements of blood pressure. So with blood pressure, there's 5 different classifications. You have normal, elevated, stage 1 hypertension, stage 2 hypertension, and hypertensive crisis. So there are various classifications as it relates to blood pressure depending on what your blood pressure is. Some lifestyle changes may be needed to bring it to a normal or elevated level. So let me sort of explain a little bit more what this chart means. So when you are at a normal blood pressure, usually this ranges from 120 to 80. So you want to maintain that blood pressure. And that's just, that's the recommended, is to try to keep your blood pressure at 120 over 80. An elevated blood pressure is somewhat higher than the normal. It's at roughly 129 over 80. And with this type of blood pressure, you just want to make some minor lifestyle changes, whether it be certain foods you eat. That's mainly what you would do if you have a little bit of an elevated blood pressure, but it's not something that's so significant. But if you are measured at 129 over 80, it's sort of basically to keep in mind that you need to make some minor lifestyle changes. And stage 1 hypertension is where you would need lifestyle changes as well as medical monitoring because it is a higher blood pressure. So this is between as far as the systolic blood pressure, it would be 130, between 130 and 139, and then a diastolic of 80 to 89. So between 139 to 89 is sort of a stage 1 hypertension. Stage 2 hypertension, which is 140 to 90, between that range. So you would need lifestyle changes, medical monitoring, as well as medications to take to help sort of lower that blood pressure. And then hypertensive crisis is an extreme case where you would need to seek immediate help. You would need to go to the doctor if your blood pressure is at 180 over 120. That's extremely high. So again, this is sort of just a chart that I want to show you how it's sort of measured. And you know, if you have any of these higher blood pressures, again, when you get to stage 1, lifestyle changes and medical monitoring. Stage 2, lifestyle changes, medical monitoring and medications. And then hypertensive crisis, you want to seek immediate medical attention. And then with a normal, you want to maintain that. With an elevated, you just want to make minor lifestyle changes. So that's sort of in a nutshell the different types of blood pressure. Maybe later on in time, I'll explain different ways that you can lower your blood pressure and things of that sort. But at the moment, I sort of just want to explain a little bit of the classifications and the different types of blood pressures. All right, so that's pretty much it for all I have for you guys today. I want to thank you for taking the time to watch. If you do have any questions or any sort of feedback that you want to offer, you can send me an email or you can message me through my phone number that I have provided here. If you do send me a message, whether it be through my phone or email, please let me know sort of that you are wanting to ask a question from the live stream or anything of that sort, so I know it's you and that I reply back. Because sometimes I get random messages and I reply back because I don't know who it's from. So be sure to let me know who it's from when you're sending me a message. And if you do have any questions of any other live streams, I would be willing to answer those questions. And I am still working on trying to get the chat to work where I can look at your guys' questions or comments during the chat, but right now, as a presentation, I can't really see the chat, so I am still working on getting that fixed so that I can talk to you guys one-on-one during the live stream. But as of now, I will answer your questions after I finish the live stream. But I am working on that, and I will get that finished to where I can talk to you guys one-on-one through the live stream. But with that being said, that's pretty much all I have for you guys today. I do have another live stream next Wednesday at 12 to the same time, and I'll be talking about macros. I'm excited to talk about that one because that's another important thing that you should keep in mind. And again, I want to mention that the 50% off is still going on for the rest of the week for any of my online fitness programs. So feel free to contact me through this email or the phone number I have here on screen. And that's all I have for you guys today. And I hope you have a happy new year. And I will see you guys in the next live stream on next Wednesday.